Welcome to Ask Dr. Patel, where I answer your questions about medical marijuana. I'm Dr. Patel. I specialize in the area of medical marijuana, and what that means is that I step-by-step walk patients through how to specifically use marijuana for their particular medical conditions. So let's get on to today's question. It comes from Vanessa of Alamo, California, and here's what she writes. Dr. Patel, I've been suffering from Crohn's disease for years now. When I'm in remission, I may get some discomfort here and there, but things get really bad when I have a flare-up. I feel bloated, I get really nauseous, which destroys my appetite. Sometimes the cramping in my stomach is so painful that it leaves me curled up in a ball on the floor. The worst is that I have zero control of my bowel movements. I just never know when I'll have to make a run for it to the bathroom. For this reason, I said goodbye to events like street fairs a long time ago. I'm left feeling like I'm missing out on life because of this condition. I also get anemic from time to time because of the Crohn's disease. And I wake up feeling so exhausted, I literally have to peel myself off my bed. I also end up feeling really cranky from these symptoms, and I'm not as kind as I'd like to be towards my family, especially my kids. During the flare-ups, my doctor prescribes steroids, but I have a lot of trouble sleeping when I'm on these. To prevent flare-ups in the first place, my doctor puts me on drugs that suppress my immune system. But I read that these drugs not only cause inflammation of my liver and pancreas, but cancer, which really has me concerned. On my own, I've tried every diet under the sun. I eliminated so many ingredients from my diet that I was actually left with nothing to eat. Honestly, I feel like I'm at a loss. Recently, I found myself thinking about using medical marijuana because a friend of a friend told me that it helps her with her symptoms. But I'm just wondering if it's a worthwhile route to pursue. Feeling defeated, Vanessa. So, Vanessa, I'm really glad you wrote in. And actually, I'm quite surprised that you wrote in too, because not too many people know about medical marijuana as a possible treatment option for Crohn's disease. More and more people, like the friend of a friend that you mentioned, are starting to find out, but it's not something that's very widely known. So I want to answer your question by telling you about some recent research that was done. It was done in 2013, and in this particular study, what they did was they took a group of about 21 patients. And these patients had been diagnosed with Crohn's disease. Now, they also had a history of not responding to conventional pharmaceutical drugs. So drugs such as Remicade, methotrexate, Asacol, prednisone, just to name a few, okay? And they took half of these patients and they had them smoke cannabis cigarettes with THC. I'm going to refer to this group as the cannabis group. And they had the other half of these patients smoke cannabis cigarettes without THC. And I'm going to refer to this group as a placebo group. Now, as a side note, yes, they had these patients smoke joints, which I don't recommend because it does do damage to your health long term. Okay? So, back to this study. They had these patients smoke these cannabis cigarettes over the course of several weeks, twice a day. Okay? And what they found was a couple of things. Now, in the cannabis group, 10 of the 11 patients reported back saying that they had an improvement in their symptoms. So they said that they had a reduction in their pain, in their abdominal pain, and that they had an improvement in their appetite. But only 4 of the 10 patients in the placebo group reported the same, okay? The other thing is that 5 of the 11 patients in the cannabis group reported a remission of their symptoms. So symptoms completely gone. But only 1 of the 10 patients in the placebo group reported the same. Now, the researchers found this really interesting, and they were quite surprised by the results because these patients had stopped responding to pharmaceutical drugs in the first place, okay? Now, here's what I found most interesting. First thing is that none of the patients reported any side effects, such as changes in their memory or concentration or any confusion. The other thing is that none of the patients had any withdrawal symptoms after they stopped using the marijuana. So that's pretty significant. Now, what do my own patients report back to me? So they say mainly two things. The first is that they do experience a reduction in their nausea, which helps to improve their appetite. And then the other thing is that they experience a reduction in their abdominal cramping. And that then helps to reduce that sense of urgency that patients with Crohn's disease unfortunately tend to get. Overall, they experience a sense of normalcy in their lives, and they can go back to doing things like going to street fairs, for instance. So, Vanessa, I really hope this helps you. And anyone else out there that's looking for more information on treating symptoms of Crohn's disease with medical marijuana. Now, I have a favor to ask of you. So if you have any questions for me, go ahead and post them in the comment section below.